Hi, this is Ian Wright, and I just wanted to talk about and kind of expand upon the idea of osteopathic care of children and actually why we should check children at important transitional stages where children undergo a variety of changes, be it physical changes or physiological changes or emotional changes, or even kind of integrative spiritual type changes where they're embodying themselves more. There are various different layers of transition that children go through. I mean, obviously the first transition on a physical, emotional, spiritual level is, I mean, apart from conception, is birth, which is a huge shift in the physiology, in the breathing. The breathing comes through the placenta, through the umbilical cord. The oxygen, it's not the breathing, it's the oxygenation. Then in the first breath, the heart undergoes a huge change. All the valves, some close and rechange in their position, and the lungs breathe for the first time, the first breath. It's a huge transition for the body to go through. I've talked a lot previously about this, the physical elements of birth, be it normal and abnormal, and how they can affect babies and how they can cause various symptoms from sleeplessness to irritability, etc., and how if we unravel those things, we can help babies, and also we can prevent problems coming for later. That's why all babies should be treated, but this is not what this is about. This is about more the kind of general concept of how the child develops and the potential needs and potential important times to come and have the child just evaluated. Just, it's almost like a service in the car, making sure everything's aligned and functioning correctly and stopping problems. The key point here is preventative, to prevent problems, because the more little, it's like creases you can iron out, the younger, the better. Subtle imbalances and postural alignments and difficulties with the midline can subtly affect coordination, specific learning issues, subtle changes, that can have somewhat varying results, that can be quite profound and affect, for example, processing, language processing or visual processing, and all these kinds of things that can come up against a child at school age. Anyway, key transitional times. Obviously, when a baby sits up, that's a huge change in their postural tone through their spine. The spine itself has a lot of adaptations to embody. It's taking up postural tone, and the baby is wiring up the nerves, the long chain nerves that supply the deep postural muscles, and everything wires downwards and myelinate, which is to do with the coverings of the long brain tracts, and they start at the top and go down as you start with neck control, then you get shoulder, sitting up, and then eventually you get to standing up and walking. Now, subtle imbalances in the postural midline can start to show up when you're sitting. You can see little curvatures, left-right curvatures, tendency to scoliosis of the spine. These can often be formed pre-birth in terms of molding of the head and neck, and subtle mechanical imbalances in the ribs, etc. So we always want to just check, the midline balance of the spine once the baby can sit up. And again, when you're walking, the development of gait is gait is the ability to walk. The development of gait is actually very complex in terms of balance. The balance, when one leg lifts the ground, moves through the air, and comes down, we have to have an incredible strength of postural alignment to hold our midline on one leg, and that transition between the two. And you see a toddler, when they're first walking, this kind of rolling gait that they have between the side to side, which diminishes as you get more, as we get more able to walk and hold this postural midline. But subtle, again, imbalances in the function of the hips and the extremities, and especially the spine, tend to show up. Very important time. Other important transitional times are when, as they start teething. That's a big change through the mechanics of the face, because a lot of the teething occurs actually is to do with actually the teeth moving down right through the maxilla and up through the mandible, these two bones. So they're deeply embedded, the both sets of teeth, in the bones, and they go through this fluid movement where they kind of descend and ascend, and you need to make sure the mechanics of the face. It's a really important time to allow the jaw mechanics to open out properly and look for any minor dysfunctions in that kind of thing. Again, when you start to get a little older, there's other mechanical changes that can happen, and physiological changes that start to come in. And then we can start talking about actually the emotional changes. For example, you get a 2 to 3 year old and they start to engage with their sense of will, the sense of me, I want, and it can be like the terrible 2s and 3s. And what we're interested in through these transitions and through these mechanical transitions, 2 to 3 is an important time. 5 is a huge important time emotionally, because you're starting to engage with the world, with peer groups. School starts. 7 is a big time, especially for boys, and it's a time when there are hormonal changes which are happening. The first sort of set of hormonal changes start happening. The brain is changing slightly at 7 years old, and anxiety can start to show up. And also, you often see kiddies with tummy. They can hold symptoms of stress and tension, and it's all about, they worry about particular things, especially with regards to social peer groups. And kids hold tension in their bodies, and I spend a lot of time unraveling this build-up of tension. It's really, I find 7 is a time I treat a lot of children. Then you go to about 10 years old. There's another kind of transition on a physical and emotional level that sometimes children need support in, as they're expanding and engaging more with society. And then there's the huge transition where everything changes. 12, 13, 14 years old, differing slightly between girls and boys, where you have this incredible brain rewiring that happens. The dopamine, the neurotransmitter pathways in the brain are absolutely changing. The brain actually restructures completely. So, I did a whole podcast on that. Check my old podcast on that, because it's a huge subject. Is these huge transitions that happen, on a hormonal level, on a brain level, on a physical level. The physical body through the hormonal changes is changing, but also there's a massive growth spurt. So any structural imbalances can really start to show up. Things can go off. It's like a tree being pulled offline. Everyone can go offline, at 12, 13 years old. It's a key time to make sure everything's straight, everything's balanced. Actually, the kind of key elements that I'm interested in when you're treating children through transition is balance, allowing them to be structurally and functionally balanced. Allow everything to be integrated, allow everything to be aligned, and allow them to self-regulate so their bodies can find their own balance, be it physically, emotionally, physiologically. Everything needs to find its way of regulation. And all we'd try and do in our trade as osteopaths is see where things aren't quite right, or if there's any blocks, remove them. So allowing the body to do its perfect kind of regulation, growth, balance, integration. Anyway, it's a huge subject and one I could talk about all day, but it's fascinating, and so that's why we tend to see children at these times. And actually, it's good times to actually, even if you don't have any symptoms, just to get the child checked so they can have their NCT or their MOT and see that everything's going well, and it irons out any tendencies for stuff. And I think that's I find that terribly important. I wish you well.